Okay, today we're tackling a really complex and honestly often misunderstood topic: bulimia nervosa. It's so much more than what you might see on the surface. It's a serious condition with deep psychological roots and some pretty severe physical consequences. In this explainer, we're going to break down what it is, what causes it, the hidden toll it takes on the body, and most importantly, the path to recovery. All right, let's get into it. To really get a handle on this, it kind of helps to start with the name itself. The word bulimia, it actually comes from a Greek word that means ravenous hunger. And that's such a powerful term, right? It really hints at the intense, overwhelming drive that's at the very core of this disorder. So, what's the official definition? Well, clinically, bulimia nervosa is defined by this destructive cycle of binge eating and then purging. And while it feels like we've been talking about it for a while, it was only formally classified as its own distinct eating disorder back in 1979 by a British psychiatrist named Gerald Russell. Now, this is where we have to bust a major stereotype. I think a lot of us assume that people with bulimia are underweight, but that's just often not the case at all. Take a look at this 2012 study. It found that a huge majority of the participants, 64%, were actually overweight. 36% were at a normal weight. And part of the reason for this is that the body can absorb up to half the calories from food even before purging happens. So here's our game plan for this explainer. We'll start with what it is, then dig into the causes, explore the physical impact, look at how a diagnosis is actually made, and then we'll talk about the road to recovery. All right, first up, let's look beyond that basic definition and really try to understand what bulimia nervosa is all about. The condition generally shows up in two main ways. The most common form, the one you probably hear about most, is purging bulimia. This involves things like self-induced vomiting or using laxatives. But there's also a much rarer form called non-purging bulimia. And in this case, the person uses other methods, like extreme fasting or compulsive exercise, to compensate instead of regular purging. Okay, and this is so important to understand. This is not just about food and weight. It's deeply psychological. People with bulimia often wrestle with really low self-esteem and a distorted body image, seeing themselves as overweight no matter their actual size. This is a huge reason why the condition is so often linked with depression, anxiety, and unfortunately, a high risk of self-harm. So that leads us to the next big question. Where does this come from? Let's unpack the causes. And I'll tell you right now, there is no single, simple answer. It's what's known as a multifactorial condition. Yeah, while we don't know the exact cause, research points to this really complex mix of factors. We're talking about everything from a possible genetic predisposition and a history of trauma to stressful life events and just persistent low self-esteem. And of course, cultural pressures, especially in jobs that are all about appearance, can play a really significant role too. All right, now we need to talk about the physical impact. Our third section is called the body's hidden toll. And here, we're going to explore how that binge-purge cycle really does affect the entire body. The thing is, the stress from this cycle doesn't just stay in one place. It has these cascading effects. This process can impact nearly every major organ system, creating some really serious and sometimes irreversible damage all throughout the body. Let's start with the most immediate point of contact. The repeated exposure to stomach acid from vomiting can just wreak havoc on the mouth and throat. We're talking about severe erosion of tooth enamel, which leads to decay, swollen glands, chronic sore throats, and even the potential for a ruptured esophagus. And the internal damage? Well, it can be even more severe. Purging messes up the body's delicate electrolyte balance, which is absolutely critical for your heart to function. This can lead to an irregular heartbeat, low blood pressure, and in the most serious cases, heart failure. On top of that, chronic dehydration puts a ton of strain on the kidneys, and the cycle can cause really painful stomach ulcers. And the effects don't stop there. Psychologically, the disorder can lead to this constant preoccupation with food and weight, right alongside depression and anxiety. It also seriously disrupts the body's hormone system, causing imbalances that can lead to irregular periods, loss of libido, and even infertility. So with all of these complex factors in play, how do professionals actually diagnose the condition? Well, that brings us to our fourth section, the DSM-5 criteria. Professionals use a very specific framework from the American Psychiatric Association, which outlines 5 core criteria. First, there have to be recurring binge eating episodes with that feeling of lost control. Second, the person uses recurrent purging or other behaviors to compensate. Third, this whole cycle has to happen on average at least once a week for 3 months. Fourth, self-worth is excessively tied to body shape and weight. And finally, these behaviors don't happen only during episodes of anorexia nervosa. Understanding the problem is the first step, but the most important part is the solution. So let's move to our final section, the road to recovery, which really requires a full team-based approach. Right off the bat, you need to know there is no one-size-fits-all cure. Effective treatment has to be highly personalized. It requires a whole team of specialists. We're talking doctors, therapists, and nutritionists, all working together to address the physical, the psychological, and the nutritional sides of the disorder. Nutritional recovery follows a careful, structured plan. The first step is always education, just understanding the consequences. From there, the main goal is to interrupt that binge-purge cycle. Then that leads to gradually stabilizing weight and reintroducing all foods to get rid of that good versus bad food mentality. And ultimately, the goal is to help the person recognize and accept a healthy weight for their body. And this is a super crucial point that often gets overlooked. Before the nutritional rehabilitation, the refeeding, can even begin, the immediate medical priority is just stabilizing the body. That means correcting those severe fluid and electrolyte imbalances that purging causes, just to make sure the heart and other vital organs are functioning safely. But in the end, lasting recovery goes so much deeper than just physical health. As this quote powerfully states, the journey has to include addressing those underlying issues of self-esteem. Teaching people to appreciate themselves isn't just a nice thing to do, it is fundamental to healing. It kind of leaves us with a critical question. In a world that is so focused on appearance, what can we all do to build a foundation of self-worth that has nothing to do with what we see in the mirror?